Confused about which Medicare plan to choose? Well, you are not alone. Medicare, one of the United States' most vital healthcare programs, can often seem like a maze. But it doesn't have to be. It's essential to understand that Medicare is divided into 4 parts: Part A, Part B, Part C, and Part D. Each part serves a different purpose and covers different types of health services. Part A covers hospital insurance, Part B covers medical insurance, Part C, also known as Medicare Advantage, offers an alternative way to receive your Medicare benefits, and Part D covers prescription drugs. Over the course of this video, we'll dive deeper into each part, breaking them down so you can understand what they offer and how they can benefit you. Remember, knowledge is power. Arming yourself with the right information can help you make the best decision. First off, let's delve into Medicare Part A. Medicare Part A, often referred to as hospital insurance, is a significant piece of the Medicare puzzle. It's designed to help cover the costs of your care in a hospital or skilled nursing facility. Think of it as your safety net if you're admitted to the hospital for a surgery, a serious illness, or any other medical condition that requires an inpatient stay. But it doesn't stop there. Medicare Part A also provides coverage for hospice care. This means if you're dealing with a terminal illness, Part A can help cover the costs of the compassionate care you need, including medical, nursing, social services, and grief counseling. In addition, Medicare Part A has a provision for home health care. This is a fantastic benefit for those who may need healthcare services but are unable to leave their homes easily. Home healthcare services can include part-time or intermittent skilled nursing care, physical therapy, speech-language pathology, and occupational therapy. Now you might be wondering about the costs associated with Part A. While many people don't have to pay a premium for Part A since they've paid Medicare taxes while working, there can be costs, like deductibles and co-insurance associated with your care. So that's Medicare Part A in a nutshell, but remember, it's only one part of the puzzle. Next up, we have Medicare Part B. Now, Medicare Part B is essentially your medical insurance. It's the component of Medicare that covers the services you need to diagnose and treat medical conditions. These services include things like visits to your doctor, outpatient care, and even the medical supplies you might need. But that's not all. Medicare Part B also has a focus on preventive services. It's all about catching potential health issues early before they become major problems. This might involve screenings for conditions like heart disease or diabetes, vaccines to prevent illnesses, and even certain types of counseling. Let's talk about costs. With Medicare Part B, you typically pay a monthly premium. The amount can vary based on factors like your income. On top of the premium, you may also have to pay a small deductible each year before Medicare starts to cover your costs. After you've met your deductible, you'll usually pay 20% of the Medicare-approved amount for most doctor services. Now, it's important to note that if you don't sign up for Part B when you're first eligible, you might have to pay a late enrollment penalty. So it's worth considering your needs and options early. That's a quick overview of Medicare Part B. It's all about covering your basic medical needs. Now let's move on to Medicare Part C. Also known as Medicare Advantage, Part C is a bit of a game changer. Think of it as the all-in-one package deal of the Medicare world. It includes all the benefits of Part A, which covers hospital stays, and Part B, which covers routine medical services, and often it also incorporates Part D, which covers prescription drugs. Medicare Part C isn't offered directly by the government, though. Instead, it's provided by private insurance companies that have been approved by Medicare. This means that while the core benefits of Part A and B are always included, the specifics can vary from plan to plan, giving you a range of options to choose from. Apart from the comprehensive coverage, another benefit of Part C is that it often includes additional services that original Medicare doesn't cover. These might include wellness programs, routine vision or dental care, and even gym memberships in some cases. But remember, while Part C offers a lot, it also typically comes with a cost. You'll often have a monthly premium on top of your Part B premium, and you could have co-payments or deductibles. Costs can vary greatly depending on the plan and the provider, so it's essential to do your homework before signing up. In a nutshell, Medicare Part C might be a good fit if you're looking for all-in-one coverage. But always remember to weigh the benefits against the costs and your personal healthcare needs. Finally, we have Medicare Part D. This is the part of Medicare that covers prescription drugs. You may think of it as your pharmacy's best friend, as it can help cover the costs of medications that are crucial to your health and well-being. Let's talk about costs. The amount that you pay for Medicare Part D can vary, depending on the specific plan you choose. Generally speaking, there's a monthly premium and you may also have a yearly deductible. Once you've met that deductible, you'll typically pay a co-payment or co-insurance for each of your medications. Now, why is this part so important? Well, imagine you regularly take prescription medications. Without coverage, the cost of these medications can add up quickly, potentially creating a heavy financial burden. That's where Medicare Part D steps in. It helps to shoulder some of that burden, making your necessary medications more affordable. But remember, not all drugs are covered under every Part D plan. It's important to check whether your specific medications are covered under the plan you're considering. Each plan has a list of covered drugs known as a formulary, which you can usually find on the plan's website. So, if you're someone who relies on prescription medications, Medicare Part D can be a real lifesaver. It's all about ensuring that you can afford the medications you need to stay healthy and live your best life. That's Medicare Part D for you, a crucial component if prescription drugs are a regular part of your life. Well, there you have it, a concise breakdown of the Medicare plans. We've uncovered the basics of Part A, your hospital insurance, strolled through Part B's medical coverage, delved into the advantage of Part C, and decoded the purpose of Part D, your prescription drug plan. It's vital to remember every individual's health needs are unique. Consider this when choosing a plan, as it can significantly impact your health outcomes. Remember, the best Medicare plan for you depends on your personal health needs and circumstances. Choose wisely.